Hi, this is the second video on dizziness. Dizziness in the elderly. It is a common complaint in the elderly population. Some common causes are postural hypotension, also known as orthostatic hypotension, occurs when a person's blood pressure falls when suddenly standing up from a lying or sitting position. Severe drops in blood pressure can lead to fainting with a possibility of injury. Causes include the following: the aging process. Postural hypotension is more common in older people. Hypovolemia, or a drop in the volume of blood. And dehydration, low fluid volume in the body. Additional causes of elderly dizziness are medications used to control blood pressure can also be a cause. Cerebrovascular disease, the disease of the blood vessels in the brain, particularly in the elderly, can be a cause. Middle ear infections can also be a cause of dizziness in the elderly. Even the simple accumulation of earwax in the external canal may also be a cause of dizziness in the elderly. Cancer, either primary or secondary, can also be a cause. Dizziness in the child. Dizziness is not a common symptom in children. Therefore, when it presents, it must be given serious consideration. Vertigo can be a symptom of a serious malady. The possibility of a brain tumor or a focus of seizure activity in the brain must be considered. Meningitis and other brain infections must also be considered. Drug reactions must be considered. Cardiac arrhythmias must also be considered. Infections of the inner ear and middle ear could be a cause. Migraines have been known to be a cause. And vestibular neuritis. Vestibular neuritis is a disorder that affects the nerve of the inner ear called the vestibular cochlear nerve. The disorder may cause a person to experience such symptoms as sudden severe vertigo, dizziness, balance difficulties, nausea, vomiting, and concentration difficulties. These symptoms are similar to Meniere's disease, but without the ringing in the ear that is present with Meniere's. Let's end this video with a few more words on the topic of benign positional vertigo. In the previous video, we mentioned that sometimes changing head positions can cause vertigo. This is called benign positional vertigo. It affects all ages. The attacks are brief, lasting minutes, and subside quickly. It is diagnosed by the physician, taking the patient from a sitting position on the exam table to a lying down position with the head hanging below the level of the table. The physician will do this 3 times. With the head kept straight, the head rotated to the right, and with the head rotated to the left. The physician will hold the patient in each of these positions for at least a half a minute. The physician will then observe if the patient has nystagmus and if the patient has symptoms of vertigo. So the complaint of dizziness is not something that can be treated lightly and must be thoroughly worked up by a physician. Well, I hope this helps. Have a good day.